Welcome to Mom Matters. I'm your host, Alyssa Dver. In the next 10 easy-to-watch minutes, we're going to give you some really practical tips for productive parenting. Tonight's topic is vital signs when a nurse is all you need. And joining us is one of my favorite nurses, Dver Moore. Deb, thanks for joining us. Deb is a nurse practitioner, and we're going to talk about the differences between the different types of nurses in just a minute. But Deb's been a nurse for 25 years. She is currently in a practice, an internal medicine practice, and she's a mom of 2 children of her own, who are now ages 16 and 18. Mm-hmm. Welcome to our show again. Thank you for being here in your busy schedule.
Thank you for having me. It's been a pleasure.
So, what is the difference between a nurse practitioner, a registered nurse, and all the other different variants that we hear about?
Well, the term nurse is sort of a global term for many different kinds of nurses. There are licensed practical nurses who undergo about a year's worth of training. They're not college educated and they provide direct patient care. Okay. Registered nurses are college educated nurses either for 2 years or 4 years, and at the end of their training they take a rigorous licensing exam in order for them to practice under doctor's orders. Nurse practitioners are under a slightly different umbrella, one called the advanced practice nursing, which also includes nurse midwives, nurse anesthetists, as well as nurse practitioners. And they are master's trained nurses who also take a rigorous licensing exam, as well as about 500 clinical hours of training.
Wow, so there are big differences in terms of the training. In a single practice, you might have a mix of different nurses. So what are the fundamental differences between what they actually do? You said direct patient care. What does that mean? And what would if I went to an internal medicine practice, for example, what kinds of services would the different nurses do for me or my child?
That's a good question. A registered nurse provides direct patient care, which means they would give immunizations, they would take your blood pressure, your temperature, your pulse. They might take a brief history in terms of what kinds of medications you take, etc. Nurse practitioners, on the other hand, can actually diagnose problems. We can prescribe medications, we do physicals, we do urgent care visits, we do follow-ups for complex medical issues, we interpret lab data, x-rays, etc.
Okay, so when I do call and want to schedule my physical and they say, you know, the doctor can't see you for 9 months, but you can come see the nurse practitioner and we can schedule in a month, that seems like it fits in that scope of things that you just described.
Right, that's a perfect use for nurse practitioners. Physicals are a big part of what I do.
Okay. And also when you call, sometimes they'll offer you to, as a patient, the ability to talk to a nurse practitioner on the phone. Mm-hmm. So you can do some of that consultation on the phone, right?
Right. I think our training and experience allows us to make good sound advice and judgment over the phone.
Okay. So when is the time that you start to get the doctors involved? I know there's circumstances that obviously you come in for a physical and you see something on a patient. I would assume, what's the procedure at that point to say, this is beyond standard routine stuff?
We work collaboratively with the physicians in our practices, wherever we work, which means for patients is that they get the best of both worlds. They get a nurse practitioner to take care of the most routine things, but if I see something that I'm either not sure of what it is or how to treat it, I always, and all nurse practitioners speak to their collaborating physician to get their advice or to even have them come in and see the patient with us.
Okay. All right, good. Well, that leads us to probably the most top of the mind question I'm sure many of our viewers have, which is as a patient, when do you insist on seeing the doctor? So before you answer that, we're going to take a quick break. And we'll be right back after about 30 seconds and ask Deb about when do we have to stand up and say, I need to see the doctor. We'll be right back.
In the new book, Healthy Eating During Pregnancy, you'll find all the information you need for having a healthy diet before, during, and after pregnancy. Inside, find nutrition basics on everything from vitamins and minerals to reading food labels. Special sections on morning sickness, food safety, and the latest guidelines for diabetic moms-to-be. You'll also find easy-to-use checklists and hundreds of recipes for daily meal planning. So get Healthy Eating During Pregnancy now at Amazon.com, BarnesandNoble.com, or at a bookstore near you.
Welcome back to Mom Matters. We're here talking with Dver Moore about when you see a nurse and when you don't.
Stop.
Welcome back to Mom Matters. We're here talking with Deborah Moore about nurses versus doctors, essentially. And the last question we talked about was, you said that you interact a lot with doctors when you need to. So I'm going to flip it around. As a patient, when do you insist? When does the patient say, look, I really need to see the doctor?
Well, I think patients have the right to decide for themselves when they make the phone call who they'd like to see.
Okay.
Obviously, nurse practitioners are more available than physicians. However, if a person feels strongly that their symptoms seem complex, or that they just feel more comfortable speaking to a physician because a physician has more education and experience, then that's really who they should see. Because at the end of the day, we want people to be comfortable with their provider, whether it's a nurse practitioner or physician. And neither of us feel offended if a patient wants to see one or the other.
So does it happen that somebody comes in, they see you or a nurse practitioner, and they say, halfway through the exam or whatever it is, I really need to see the doctor? Does that happen?
That's never happened.
Oh, okay.
Sometimes it happens to me, where I'll be listening to someone's history and I'll say, I'm not really quite sure what's going on here. And then I will excuse myself and tell the patient that I'm going to go ask my collaborating physician a couple of questions about their symptoms, because I need more I maybe need an extra set of ears to hear what's going on. And patients always appreciate that I understand what my limitations are. And they really get a 2-for-1 at that point. They get the physicians and
I can see
me.
that. I can see that. So is it fair to assume that when you make the call, like you said, either think about, are you going in for something routine, something that's not totally unusual for your own medical history, your child's own medical history.
Mm-hmm.
But even once you get there, if there's something out of the ordinary that happens, or you just feel like you need to get a consulting opinion from the doctor, it's okay to ask the nurse to do that.
Absolutely.
Okay, great. Well, we're a web show, and that brings to mind all these websites that are out there, the WebMDs and like that, where you can go and get diagnostic information, if you will, as a patient. So is that a good thing, that when patients come in and they've been reading the web and they kind of come in and say, I think I have so-and-so disease, is that a good thing, something you recommend that they do before they come and see you?
It's not necessarily recommended. People do it a lot, and I think probably more than they admit to me. But I think those sites are full of useful information. However, it's difficult for someone who doesn't have a medical degree or a nursing degree to diagnose themselves. And while I appreciate the information that's on those websites, I really don't encourage people to self-diagnose, because sometimes they could be missing a piece of the puzzle, and then may go out to the drugstore and get medication that wouldn't be useful, or B, detrimental to their condition. So I would always encourage people to call and just run their symptoms or their history by the secretary, and they can give the information to one of the providers, either a nurse practitioner or a physician, to help the patient decide whether they need to come in or not.
So probably a good resource maybe after you've seen the professional, so you can get more details or get a little bit more information about what you were told that you probably have, but not necessarily useful in the context of going into the doctor and saying, I think I have XYZ ailment.
Right. I firmly believe that. I think they're a good resource, but I don't think that they should be used for self-diagnosis.
Fair enough. I think it's good advice. We always like to tell our viewers, there's great information on the internet, but use it wisely, and always go to the professional, whether it's a doctor or chiropractor, whoever it is that you're working with. Don't just trust the information out there, because it's not all great stuff, unfortunately. Although we're great stuff.
Well, I think overall the information is really good, but I think the physician or nurse practitioner knows the patient's history and some other pertinent information that the websites just don't know.
Great. Thanks, Deb. I appreciate the information you've provided tonight. I'm going to wrap up tonight's show. Just remind folks about our website, which is www.mom-matters.com. You can see our archive shows as well as information about our upcoming shows. This is Alyssa Dver for Mom Matters, giving you practical tips for more productive parenting.